Hey everybody, welcome back. This is Nurse Eunice and I am so excited tonight. We're going to be reviewing 50 multiple choice questions to help you pass your CNA and your PCT exams. So as we do in each video, we're going to give you a few moments to receive your notifications, and I am so proud of you. From Okafor to Tiffany to Marquise, we've received so many messages about you all passing your CNA test, and so that's what I am here for. I am here to help serve you and to help you into the medical field. So I am so proud of you. Give yourself applause and let's get to it. Welcome, everybody. All right, so hey, future CNAs, welcome to Florida Training Academy's official YouTube channel, where we help you pass your exam, gain confidence, and start your healthcare career strong. In today's video, we're going over 50 must-know CNA practice questions. This test is focused on you learning terminology also. So this test is designed to help test your knowledge, sharpen your skills, and boost your confidence for the big day. Whether you're just starting your CNA journey or getting ready to retest, this is the perfect review session for you. And a lot of people will ask, they'll be like, hey, Nurse Eunice, are these the questions that's on my state test? No, these are not going to be the exact questions that are on your state test. It would be against the law for me to share that information with you if I had it. However, what I need you to do is, as you are listening to these videos, I need for you to understand the key terms and the care concept. Once you hear a term, what is the CNA's role? What is the nurse's role? And so when you break the questions down like that, it doesn't matter what question they ask you on your state CNA examination, because you should understand your role as a CNA as it relates to that medical term or that medical condition. And so that's how I want you to study and break everything down. And that is right, team. Yes, we have our $7 vital signs bundle. It comes with flow charts. It comes with practice tests. It also comes with additional lecture materials. So if you've never used the QR code before, you're going to open up your phone app. So just like this, you're going to open up the camera app on your phone, and then you're going to hover over the QR code. There's going to be a link that appears. Click that link, and it's going to take you directly to the $7 vital signs bundle, or there is a banner that's going across the bottom of the screen. You can go to nurseeunice.com, scroll down to the bottom. Not only will you be able to see the vital sign bundles, but you'll see a plethora of resources designed to help you pass your CNA and your PCT examinations. So let us get ready for our practice tests. Let's build your confidence. Before we begin, find a quiet space to focus. Have a notebook or scratch paper ready, because I need you to take notes to learn these terms. Read each question carefully, and then trust your instincts. You already have the heart for patient care. Question 1. You are assisting a patient who suddenly begins to choke while eating. The patient is unable to cough or speak. What should you do first? Would it be A, offer sips of water, B, begin abdominal thrust, C, lower the patient's head to the table, or D, run to get the nurse? All right, we'll give you a few moments to put your answer in the chat. And again, congratulations to all of those who took your test and passed. And if you haven't taken your test, don't forget, whenever you send us your test results, we're going to recommend that you actually request an audio test. It doesn't cost any more money. They're going to give you an ear piece, a headset, where only you can hear the questions being read to you. Look, at this point, it's not about pride. It's about you passing this test. And if you don't know terminology, or if English is your second language, sometimes you can misinterpret the word because you're spelling it wrong or you're pronunciating it wrong. And so the best thing to do is to ask for that additional help. And so whenever your school or whenever you are registering for your CNA state examination, you can ask for that audio test. And again, it's no additional fee. Get as much help as you can. All right, so question 1, that was the easy one. Yes, it is B. So a patient who cannot cough or speak or breathe is experiencing complete airway obstruction. That means that you have to jump into action, you all. CNAs are trained during their CPR classes to perform abdominal thrust. And so the reason why we use the term abdominal thrust is because the previous term Heimlich maneuver is now copyrighted. So you're going to hear us say abdominal thrust instead. But yes, you're going to jump into action. You're going to do those abdominal thrusts. And yes, you can be screaming out for the nurse while you're doing so. But that's going to help clear that person's airway immediately. Do not nurse. You're going to have to stay in there with that patient, help them out, do the abdominal thrust, because if they go into cardiac arrest, we're going to need for you to start CPR right then. Okay. You all do so much to help our patients, and we appreciate you. Question 2. Which of the following is a CNA's responsibility when caring for a patient with a nasal gastric tube? Is it A, administering medications through the NG tube, B, adjusting the feeding rate, C, flushing the tube with saline, or D, monitoring for signs of discomfort or dislodgement? Depending on where you're working, especially if you're working in an acute care center like a hospital, you're going to have patients who have nasal gastric tubes, okay? And so if they do have a tube that's going pretty much through their nostril down into their stomach, you need to know what to do. And so if you chose D, you are right. Look, you're just monitoring at this point. So CNAs do not administer medications or flush NG tubes, but they can observe for issues like dislodgement or discomfort. Or let's say when you look at her nose, let's say that adhesive, that tape began to come up, because sometimes your patients are busybodies. They're turning and doing all kinds of things. That'll be something you want to make your nurse be made aware, because if that tape loosens, then of course that tube can come out. It will end up being an inconvenience to your patient because your nurse will have to put that back in. But on top of that, now your nurse has an extra duty, which could have been stopped once you actually realized that adhesive was coming out. So you as a CNA, you help the nurse, and by helping the nurse, you help the patients. Question 3. The heart is located in which body cavity? Is it A, abdominal cavity, B, cranial cavity, C, thoracic cavity, or D, pelvic cavity? All right, revealing the answer in 3, 2, and if you chose C, you're absolutely right. Great job. So the thoracic cavity, the chest area, is what houses the heart and the lungs. So I hope you learned something new today. Let's go to our next one. Question 4. When ambulating a post-surgical patient, you notice they suddenly become pale and begin to sink toward the floor. What is your best immediate action? Is it A, hold the patient upright until the nurse arrives, B, lower the patient safely to the floor, C, place the patient back into bed quickly, or D, call out for help and leave the patient standing? That is right. Great job, team. It is B. Look, we're not going to leave someone standing if they're getting pale because of the lack of blood flow. That's a sign of poor circulation. So you're going to prevent your patient from falling and from injury by safely lowering them to the floor. Yes, you can be calling out for help, but do not leave them standing. Don't try to hold them up against the wall. Don't try to hold them up at all, because they're going to fall on you, or you in turn may fall on them. And so our job is to prevent an injury, get them to the floor safely. And then once they're on the floor, make sure you support their head. So if they're still sitting upright and they're on the floor and you don't support their head, they can fall forward or fall sideways, which means they can still injure themselves. So don't take your hands off of them. All right, next question. Great job. Question 5. A patient with a Foley catheter complains of discomfort, and you noticed no urine is draining into the bag. What is the first action you should take? Is it A, check for kinks in the tubing, B, continue to monitor, C, empty the drainage bag, or D, call for the nurse immediately? That's right. We need to know if you understand your scope of practice. What is your role as a CNA? All right, I'm seeing some variant answers for this one. So revealing the correct response in 3, 2, and that's right. If you chose A, great job. You understand that a CNA you're not going to reinsert a catheter. You're going to troubleshoot. You're going to check for kinks and try to release that kink to see if the urine flows. And then if the urine doesn't flow, that's when you're going to get your nurse into that room right away. Get your nurse into the room so that she can come and assess. So CNAs cannot reinsert catheters, but they can inspect for correct simple issues like tubing kinks that may block the urine flow. All right, let's go to our next one. All right, so next, question number 6. Which is a sign of depression in elderly patients? Would it be A, increased social activity, B, enhanced appetite, C, excessive laughter, or D, withdrawal from activities? Depression in the elderly. You're probably one of the only smiling faces that they see because their family members don't visit them that often. So how would you know if your elderly patient was depressed? And that's right. If you chose D, they could start withdrawing. Maybe they were someone who used to like to play bingo, and now they don't want to play bingo anymore. Well, that will be a sign that maybe there is an emotional change. So depression often leads to withdrawal and loss of interest in activities. And you're going to be one of the first people who actually can detect that. So talk to your patient, figure out what's going on with them. And if you feel that it's something worth telling, please notify your nurse. I'm having a little problem here at my screen, so just bear with me. There we go. All right, question 7. While performing a bed bath, you notice the patient's skin is red over the sacrum and does not blanch when pressed. What should you do immediately? Would it be A, apply lotion, B, reposition the patient off the sacrum, C, cover with a blanket, or D, ignore it until the nurse rounds? So this is going to require you to understand what 2 terms are. You have to understand what the sacrum is, and you have to understand the term blanch. And if you don't know what those terms mean, I need for you to be writing those down, because remember, today, you're just not answering questions, you're learning terminology. All right, so the answer to question 7 is going to be B. That is right. But just because you knew the answer, it doesn't mean that you understand the terms. And so if you know what blanching means, go ahead and put it in the chat right now. So a non-blanchable red area is a sign of a pressure injury. Repositioning, that means turning your patients, reduces further pressure and damage while waiting for the nurse. And so yes, you have it right. That's what blanching means. Great job. And so if you don't see that response, I'm not going to tell you, because I need for you to look that word up. I trust you. Pause the video, look it up, and then put it in the chat. All right, question 8. Which of the following is considered a standard precaution? Okay, and so would it be A, wearing gloves for all patient contact, B, isolating all patients with a fever? Is it C, washing hands before and after glove use, or D, using mask for every patient? Standard precautions. These are just standard across the board, regardless of your facility, regardless of the patient type. What would be the standard precaution? Yes, absolutely. You have it. It is C. That's right. We're going to wash those hands for 20 seconds or more, according to the CDC. So hand washing is a universal standard precaution. That means globally, locally, regardless of your facility. As far as the gloves or the mask, gloves are only going to be used when you're going to be exposed to bodily fluids. But then as far as the mask, of course, your patient would have to have something that would be spread via the air in order for it to necessitate a mask. So mask and gloves just are not standard precautions in themselves. Your patient must have a condition or a situation that warrants the use of the additional PPE. Question 9. The sacrum is located at which part of the body? Is it A, the base of the skull? Is it B, the top of the sternum? Is it C, behind the knee? Or is it D, lower back between the hip bones? Where is the sacrum located? We just talked about it in a previous question, but I never told you the location. So I'll give you about 5 seconds on this one. All right. Revealing the correct response in 5, 4, 3. Great job, team. I see those answers coming through. Yes, that's right. So the sacrum is a triangular bone at the base of the spine, nestled between the hip bones. So the answer is D. And the sacrum is what we also consider as a bony prominence. And a bony prominence is anywhere where bone is touching bone, such as the inner knees if your patient's on their side, or bone is touching bedding. And so especially with your frail or your malnourished patients, that sacrum, their tailbone can start hurting. Okay. And so you don't want to keep them in one position for too long, because we know that the sacrum is a bony prominence. It is a bony area that is more likely to have a pressure sore develop. And so again, turning, repositioning, maybe taking them for a walk. There are some different thoughts regarding massaging bony prominences. I need for you to look up evidence-based research, but the last research that I saw said we do not massage bony prominences, and that's going to go against what a lot of other nurses say. That is why you should always research it first. Okay, so we're not going to research something we're not going to massage an area that's already likely to break down. I hope that makes sense for you. Question 10. The trachea is commonly called, is it A, the windpipe, B, food pipe, C, voice box, or D, chest bone? Because sometimes we have to speak in terms that our patients can understand. And so if we go to them, we can say trachea, but we have to relate it to something else. And so if you chose 3, 2, and that is right. Give yourself applause. It is A. The trachea is also known as the windpipe because it carries air or oxygen to and from the lungs. So that would be the trachea. Question 11. How often should perinatal care be provided for an incontinent patient? Is it A, every shift? Is it B, once a day? Is it C, after every episode of incontinence? Or is it D, twice a week? So perinatal care is the care that you provide to their genitals if they were wet, whether it was urine or if they had fecal matter. So when someone's incontinent, that means they cannot control either their urine or their bladder, so they're wet. How often are you going to provide perinatal care for someone who is wet? Are you just going to do it once per shift? All right, so if you chose A, you are incorrect, you all. We cannot just change someone or clean them once per shift. They're going to end up with a diaper rash. Their skin is going to become eroded. That's going to be a breeding ground for infection. And so the answer is C. We're going to provide perinatal care frequently after every episode. So we're not going to leave them their urine or fecal matter. Once it happens, we're going to clean them up. And the best rule of thumb is prevention. Take them to the bathroom about every 2 hours. And hopefully that will prevent them from having an incontinent episode. Number 12, when assisting a patient with oral care, which of the following requires special attention to prevent aspiration? Is it A, a patient with dentures, B, a patient with dry mouth, C, a patient who is alert and mobile, or D, a patient who is unconscious? Oh, you all are so smart. Look, we've helped tens of thousands of students pass their CNA testing. You know what? I know you're going to be next because you know that when you're providing oral care to someone who is unconscious, they may not have a gag reflex, and therefore it's going to be really important for you to protect their airway. So with your unconscious patients, again, they don't have a gag reflex. So if you put a whole bunch of fluid in their mouth, toothpaste, a little bit of water, they're not going to be able to cough it up. So what do we do instead? Whenever we're performing oral care to someone who's unconscious, we don't sit them up like we do a person who can speak and who can cough. Instead, we're going to turn them to their sides. You're going to turn their body to their side. You're only going to use the least amount of maybe like mouthwash on the oral sponge. And we do have videos on that on our YouTube channel. And you're going to clean the inside of their mouth. So the teeth, the gums, and the tongue. And if your facility has some type of suction wand, or if the sponge attaches to suction, after you get through cleaning everything, you can activate the suction to remove the excess secretions. And that is going to be the safest way to provide oral care to someone who is unconscious or who does not have a gag reflex. 13. The bladder is a part of which body system? Is it A, respiratory, B, urinary, C, digestive, or D, endocrine? And this is an easy one. So I'll give you about 3 more seconds to enter your answers into the chat. And you're absolutely right. It is B. So the bladder stores urine and therefore is part of the urinary system. Question 14. Which of the following is an example of a biohazard? Is it A, a used tissue, B, a patient's food tray, C, a soiled dressing, or D, a pair of clean gloves? Which would be an example of a biohazardous item? That is right. Okay, so it's not just a used tissue because someone could have, blown their nose, but there's no obvious signs of blood on it. So if it was a bloody tissue, but the question did not say that, then you could possibly consider A. And so you all, if you chose C, you're right, because we know what's on those dressings. It has exudate, it has blood, so it's different colors. So a soiled dressing contains bodily fluids, and therefore that is considered biohazardous. Question 15. The kidneys are responsible for which of the following? Is it A, pumping blood, B, making insulin, C, absorbing nutrients, or D, filtering waste from the blood? That's right. We expect you to know anatomy, physiology, terminology, your role, how to keep patients safe. You as a CNA, again, your job is so important. It is vital. And so if you understand the role of the kidneys, you understand that the kidneys filter, they remove waste. So the answer is D. The kidneys filter waste and excess fluid from the blood, and then by forming from the blood to the urine. So that's how it filters everything. And so like our dialysis patients, because sometimes their kidneys, when their kidneys stop working, they sometimes stop producing urine. Or if they do produce urine, it's not removing any of the toxins. And that's when they end up being on hemodialysis. We put them on a machine that's going to clean their blood. And so we call that the kidney machine. So whenever someone's kidneys stop working, they also have dietary restrictions. They can't eat everything. They can't eat things that are high in potassium, because too much potassium can cause the heart to go into an irregular rhythm, which can cause cardiac arrest. And so it's really important for you to, give them those reminders and for you to understand what foods are high in potassium, because you're going to be the one who tells them, well, Mr. Mitchell, you're not supposed to be eating that. It has potassium in it. All right. And when in doubt, ask your nurse. Question 16. The femur is located in which part of the body? Is it A, the arm, B, thigh, C, calf, or D, back? Where is the femur located? I know you've heard of these terms before. Now we got to bring it back to memory because you may end up working on the orthopedic floor. You never know where you're going to be hired. And your orthopedic patient may have broken their femur. And I need for you to know that they broke their thigh bone. Yes, so it's B. The femur is the thigh bone, the longest bone in the body. All right, next question, 17. The sternum is also known as, is it A, shoulder blade, B, collarbone, C, tailbone, or D, breastbone? All right, and so I hope that you learned this when you took your CPR course. And if not, I have a free CPR video. It's a CPR and AED refresher. You can either get to it by going to my YouTube channel, or if you go to nurseeunice.com, just scrolling at the bottom, you're going to see it as one of the options. It's going to say free CPR and AED refresher course. And so with that being said, that was a great hint. So if we're talking about the sternum, we must be talking about D, the breastbone. And so, yes, during CPR, there is a possibility that we may crack or break the sternum, but we have to do so in order to compress deeply, because if we don't compress deeply enough, if we don't get to the heart, that means the person doesn't get any blood flow to their brain. So we're going to sacrifice their sternum in order to save their life and to save the brain. All right, so the sternum or breastbone is located in the center of the chest. And when you'll most often hear about that is during your CPR classes. 18, and we're going all the way to 50. And so let me say that now, we're going all the way to 50. So if you've stayed this long, I need for you to give us a thumbs up. Go ahead and give us a like. Tell a cohort, tell one of your students or your fellow classmates about us. Tell your teachers about us, because sometimes the teachers don't know that we exist. And there's no reason for you to be filling these CNA and these PCT tests, not when I've created thousands of videos already. So I need for you to pass these tests and to get to work. All right. So with that being said, question 18, the patella is found where? Is it A, elbow, B, ankle, C, knee, or D, hip? You're reading the medical record, you're getting a new admission, and it says that the patient has patella pain. What in the ham and cheese does that mean? I need for you to know some of these terms. And so if you know that patella is another word for C, knee, absolutely. Look, your patient slipped on ice and now they're in your facility for an evaluation because their kneecap hurts. So the patella is the kneecap. And so let's actually protect your patients from slip and falls so they don't end up in your hospitals with fractures. 19. Which of the following is most important when feeding a patient who is at risk for aspiration? Is it A, feeding the patient while they're lying flat? B, offering large spoonfuls to speed up the process? C, giving thin liquids with a straw? Or D, positioning the patient into an upright sitting position? What is the most important? Which of the following is the most important when you're feeding a patient who's at risk of aspiration? So aspiration is another term that you have to know. Yep. You have to know what these terms mean because you're going to have patients who are on aspiration precautions. And so if someone's on aspiration precautions, that means that they're more likely to have food or fluid go into their lungs. And so we have to sit them up. It is D. Upright positioning helps to prevent food or fluids from entering the airway. Thin liquids are usually something that would not be allowed. They have to have thick liquids. So thin liquids and straws can increase aspiration risk, and patients should never be fed when lying flat. As a matter of fact, when you're taking your hands-on, your clinical CNA examination, they're usually, if you're chosen to perform the feeding skill, either your resident is going to be leaned forward or they're going to be flat in the bed. So after your introduction, after you wash your hands, I need for you to put them in a proper position. You're going to sit them upright. I say sit them up as high as they can tolerate, because what happens is if a person starts to aspirate, they start coughing when you're feeding them, especially if they're in a reclining position, that's when you want to sit them up. And when you do sit them up, you're not hitting them in the back. If you hit them in the back, you actually make the object go further down. So what do you do instead? You sit them up and encourage them to cough. And it may be messy, so have a towel or something there, but you want them to cough it up. Even if it doesn't come out of their mouth, if you cough it up, if they cough it up, maybe when they swallow it down, it will go into their stomach versus being in their airway. So rule of thumb, sit them up, reposition them with pillows. During the mealtime is not the best time for comfort. You can make them comfortable after they've eaten and their food has had time to digest. 20. Which of the following best describes ROM exercises? All right, do you know what ROM stands for? Put that in the chat. All right, so would it be A, exercises that strengthen the heart, B, mental exercises to improve memory, C, exercises to build muscle mass, or D, activities that help maintain joint mobility? When we talk about ROM exercises, what are we talking about? Because we don't speak in full sentences. We use all this medical jargon, these acronyms. And so when you go into a patient's room, you're not going to say, hey, I'm here to do your ROM exercises. Instead, you're going to say, that is right. I'm here to help you with your range of motion. So the answer is D. Range of motion exercises prevent joint stiffness and also promote flexibility. Question 21. A patient's blood pressure is recorded as 180 over 110 millimeters of mercury. What should the CNA do? Is it A, record it and wait for the next scheduled check? B, immediately report it to the nurse? C, ask the patient if they feel okay and do nothing? Or D, recheck in an hour before reporting? And I am so proud of Okafor. Okafor, she actually signed up for our online CNA course. She purchased our book. And Okafor, she didn't pass her test 2 times. But with our resources and a little bit of encouragement and her learning her vital signs, guess what? She passed her CNA examination. She just gave us notification on Tuesday. So we are so proud of you. Next stop, nursing school. So I need for you to know your vital signs, you all. And you're just not knowing it for your test. You're knowing it because in the real world, you have to know when to tell me. And if you don't know your normal values, if you don't know when something's elevated or if it's below normal, that means your patients are going to suffer. And I have a free video on YouTube that talks about vital signs it talks about vital signs. In addition to that, we also have our vital sign bundle that you can purchase on nurseeunice.com. So no excuses. You have to learn it because I know you want to be a safe caregiver. And question 21, yes, it is B. Look, that blood pressure was way too high. And this is a hypertensive crisis and requires immediate attention. Keep that patient in the bed. They cannot get up. That nurse must come in and assess that patient. 22, the scapula is also called the, is it A, shin bone, B, shoulder blade, C, collarbone, or D, wrist bone? What is the scapula? And ding, ding, ding. Yes, you have it right. It is B. The scapula is the flat triangular bone forming the back of the shoulder as in the image. So that would be the scapula. 23. Which patient is most likely to require a high-calorie, high-protein diet? Is it A, a patient with a broken arm who's walking independently? B, a patient who is obese and trying to lose weight? C, a patient recovering from major surgery or burns? Or D, a patient on bed rest for 1 day? High calorie, high protein. Yep. Anytime you hear high protein, think of healing, think of wounds. So 23 is C. Patients healing from burns or surgery need extra calories and protein to support tissue repair and energy needs. The body uses more nutrients during the healing process. So great job if you knew that 23 was C. 24, when feeding a patient who's at risk for aspiration, which position is most appropriate? Now, I know you know this one. Is it A, high fowlers, B, semi fowlers, C, supine, or D, side lying position? Yeah, that was easy for you all. It is A. I just talked about it. So, high Fowler's position prevents aspiration by keeping the airway open during feeding. 25, and we're going all the way to 50. Hang in there with me. A patient has been on bed rest for several days. Which complication is the CNA most concerned about? Is it A, dehydration, B, contractures, C, hypothermia, or D, loss of appetite? So think about all of the negative things that can happen when someone's been in a bed for multiple days. Remember, if you don't move it, you lose it. And so, yes, their joints can become fixated. So they could actually start developing contractures. It may not be to the severity of what's in this photo because this is probably a person who's been bedbound for a long time. But what can happen, pretty brisk is that their feet can start to drop. And so that foot drop is real. What you can do is once you notice it, you can put a pillow against it to kind of keep those feet up in the proper position. But when your patients are in the bed for a long time and they're not moving, just things start to get lax. So they may cross their arms, they may cross their legs. And when we try to uncross them, they're going to say, ouch, it's going to be a really painful experience. And so we need to prevent that from happening, which is why you have to learn how to perform range of motion. And remember, you're just one part of the team. So you're going to let the nurse know that, hey, Miss Lucas, every time I try to move her arm, she's saying, ouch, it hurts. And she won't let me, extend it out. But last week she can move this arm. And so you being a good CNA, you reporting this is going to prompt that nurse to call that doctor who's going to order physical therapy, who can then come in and do exercises and order braces or whatever supportive equipment the patient to maintain their mobility. 26. What is the primary function of the trachea? We just talked about this. Is it A, to absorb oxygen into the bloodstream? B, to carry food from the mouth to the stomach? C, to carry air from the throat to the lungs? Or D, to filter waste from the blood? I expect everyone to get this answer right. There is no reason for you to answer this one incorrectly because we just talked about the trachea. Yeah, when someone has a tracheostomy, when they have an artificial airway that's coming from their neck, that's how they breathe. So guess what? The trachea is what carries oxygen from the throat to the lungs. It is C. So the tracheal windpipe is part of the respiratory system. It serves as a passageway that carries air from the pharynx or throat to the bronchi and into the lungs. It is not part of the digestive or urinary systems. We're moving right along, you all. Question 27. The ulna is a bone in which part of the body? Is it A, lower arm, B, upper leg, C, neck, or D, lower back? Where is the ulna bone? All right, I see some mixed comments in the chat. So we'll reveal the correct response in 3, 2, and you all is A. The ulna is one of the two bones in the forearm located on the side of the little finger. And let me tell you why this is important. I'm going to enlarge my screen because when you take your test, and let's say that you have to take the pulse of your resident, what you all like to do for some reason is remember the radial pulse is in the base of the wrist at the actual thumb. What you all do and what's going to fail you is that you try to feel for the ulna pulse. And they specifically told you to feel for the radial pulse. So yes, both have pulses above the bones where you can kind of feel a little bit of a sensation, but where you're going to feel the strongest sensation is the radial pulse. Okay, so don't get that wrong on your test. On your test, you're not feeling for the ulna, you're feeling right here for the radial. Right? Yeah, my babies are going to pass their test. Next question, team 28. What is the main purpose of the pancreas in the body? Is it A, to store urine, B, to filter toxins from the blood, C, to control heartbeat, or D, to produce insulin and aid in digestion? Yes, you have it. So proud of you. It is D. Anytime you think of the pancreas, think of your diabetics. So the pancreas is a vital organ that produces insulin, which regulates blood sugar and also secretes digestive enzymes that help to break down food in the small intestines. It plays roles in both the endocrine and digestive systems. So when your patient's pancreas is not working properly and is not producing enough insulin, that means their blood sugar is going to be higher. And, and that's when they have to get subcutaneous insulin. That's when they start getting injections. Some of them can, sometimes take oral anti-diabetic medications, but if it's severe, they're going to end up receiving insulin. So if the pancreas doesn't work, those sugars are going to be out of the normal. 29, the aorta, say that word with me, aorta. The aorta is the largest. Is it A, vein, B, nerve, C, artery, or D, bone? What is the aorta? Yep, I know. Is it a vein or is it an artery? We're so torn. We have some A's, we have some C's. And so the aorta is the largest artery. Great job if you chose C. So it carries oxygen-rich blood from the heart to the body. 30. The diaphragm helps with which body function? Is it swallowing, breathing, digestion, or circulation? Where is the diaphragm and what does it help with? I know you know this answer. You know it. Pull it forth. It's back there. Pull it forth. And yep, if you said breathing, B, you pulled it forth. So the diaphragm contracts. So take a deep breath in, and you're going to feel your diaphragm go in. So the diaphragm contracts and relaxes to help with inhalation and exhalation. Question 31 of 50. Yes. What is the primary purpose of an indwelling urinary catheter? Everyone should get this right. Is it A, to deliver medication into the bloodstream? B, to provide nutrition directly into the stomach? C, to monitor liver activity? Or D, to drain urine from the bladder? What is the purpose of an indwelling urinary catheter? Yes, it is D. All right, so Foley is a brand name. And so what you're going to hear in every one of your facilities is that your patient has a Foley catheter, or maybe they have a Medline, maybe it's a Baxter. So kind of like multiple companies make cornflakes, for some reason, healthcare providers feel as if the only company that makes indwelling catheters is Foley. And so that is not the case. When you take your test, they're probably never going to use a name brand. It's going to say indwelling. That means it can stay in place for up to 30 days. So an indwelling urinary catheter is a thin, flexible tube that stays in place to continuously drain urine. It is commonly used for patients who are immobile or undergoing surgery. So once the anesthesia wears off, once they're ambulatory, they're able to walk, well, then your nurse can remove, with a doctor's order, she can remove that indwelling catheter. But normally it can stay in for up to 30 days. Of course, the longer it stays in, the more likely your patient is to have a catheter-associated urinary tract infection, also referred to as a CATI. So a lot of facilities get away from putting anything inside of the body. Instead, they're going to start using PureWicks. And if you don't know what a PureWick is, I want you to look it up. If it's a male, you would then give them a urinal. So there's a device for women, and then there are devices for men. Whenever you're setting up your supplies, you have a new admission as a CNA, you have to know which one to actually select for your patients. Because if they had a catheter and now the catheter is removed, guess what? They still have to urinate. And so are you going to get them up to the toilet, the bedside commode, the bedpan? Are you going to ask the nurse if you can use a PureWick? Or if it's a man, just automatically go get that urinal and put it at his bedside. 32. The tibia is located in which part of the body? Is it A, arm, B, lower back, C, neck, B, lower leg, C, neck, or D, back? Where is the tibia located? Yeah, you got to remember those body systems from, I don't know, in high school, maybe they taught you anatomy and physiology, but definitely college, they taught you A&P if you were a healthcare major. And so the tibia it's the shin bone. It is B. So the tibia or shin bone is the larger of the two bones in the lower leg. 33. The alveoli are tiny sacs located in the, is it A, kidneys, B, brain, C, stomach, or D, lungs? Where are the alveoli located? Perfect. I see so many correct answers. Yes, the alveoli are located in the lungs. It is D. Those are those tiny air sacs where gas exchange occurs. And so when your patient's having a spirometer, remember, when it's spirometer, their breathing device, they are not inhaling. They're not blowing. When it's spirometer, they breathe in. And yes, it's going to be painful because it's making them open up those tiny alveoli, those tiny sacs in the very base of their lungs. And so you're going to be encouraging them as a CNA to actually use their spirometer according to that plan of care. So whether it's every hour, every 2 hours, get them to take some breaths in with that device, and that's going to help them get out of your hospital quicker, especially if they have respiratory concerns. 34. What is the correct term for listening to internal body sounds with a stethoscope? Yes, there's a term for that. Is it A, percussion, B, auscultation, C, palpitation, or D, observation? Yeah, when you put that stethoscope on their arm and you're listening for the Korsakoff sounds when you're doing the blood pressure, there's a term for that. And yes, you are right. We call that auscultation. You're auscultating, you all. So the answer is B. Auscultation is the act of listening to sounds within the body, such as the heart, lungs, or intestines. Percussion, that tapping, that often is for like rebound pain. Let's say somebody comes in, we think they have pancreatitis. That's not something you're going to be seeing the CNA do. That would be a nurse's role. And then palpitation, like you palpate a pulse. Palpitation involves feeling with your hands. So auscultation, ears, palpitation, your hands. 35. Which of the following procedures is used to remove fluid from around the lungs? Is it A, thoracentesis, B, paracentesis, C, lumbar puncture, or D, endoscopy? I hope you're enjoying this quiz. Yes, it is A, thoracentesis. Thoracentesis is a procedure in which a needle is inserted into the pleural space to remove excess fluid. Meanwhile, paracenteses is whenever we insert a needle to remove the abdominal fluid. And then a lumbar puncture is for spinal fluid. So whenever someone has an excess of fluid, yes, your doctor can insert a needle to aspirate to get some of that fluid off. Your patients are going to feel so much better. How do you as a CNA, where do you come to play? You're supporting that patient, because imagine the anxiety of you seeing a big needle going into your stomach or a big needle going into your knee. So especially like during lumbar punctures, that patient's going to need a lot of emotional support. So you're there holding their hands, making sure the vital sign equipment is set. And then usually afterwards, you're the person who takes that fluid, that sample, to the lab. And so you may not be the one performing or assisting the doctor, but you are in that room because that patient needs you for emotional support. And as a nurse, I need you to go take that specimen, because after a spinal or lumbar puncture, that patient's immobile for a while. And I need to be in there making sure that, they're not bleeding. So it's only so much I can do. And you're the person who helps me help that patient. 36. What is the purpose of a colostomy? Is it A, to remove kidney stones, B, to bypass the stomach, C, to create an opening for urine to leave the body, or D, create an opening for stool to leave the body? What is a colostomy? And if I'm saying words that you cannot pronounce, I need for you to pronounce these words, because remember, when you're taking your CNA examination, there's a hands-on clinical part, but then there's also a written part, multiple choice on a computer. And so I need for you, especially if English is your second language, I feel that if you can understand how to pronounce the word, that will be your cue to help you answer the question correctly. And so a colostomy is not a urostomy. A colostomy deals with the colon. And so it is D. It is a opening for stool to leave the body. As a CNA, some of your facilities may teach you how to change the wafer, but you would definitely empty that bag as needed. So you just don't empty the colostomy bag once per shift, because it can expand with gas. And so since that patient, they're not able to pass gas the natural way, now their gas is coming through their stoma into their colostomy bag. And so if it's full of gas, they're going to end up having cramps and pain. And so we call that burping the bag. You will sometimes have to open up to release that gas, and it's going to smell. I need for you to be professional, because that person has cancer, they've gotten shot, they now have body image disturbance because they have a colostomy and this bag and this air or this matter that stinks. And now you as a CNA is coming in and your facial expressions show that you don't like going into that room. So remember, if you're going to be a caregiver, it's not about you. It's about you providing the best patient care. And so you learning how to work with somebody who has a colostomy until they feel comfortable working it themselves is going to be really important, because if you are supportive, just like I'm supportive with you, I need you to be supportive with your patients so that they can start helping themselves and start taking care of their colostomy. So let me read the rationale. A colostomy is a surgical procedure where a portion of the colon is diverted to an opening in the abdominal wall to allow for stool passage, but also gas will be expelled that way also. 37. What is the term for low oxygen levels in the blood? And I know you know this. Is it A, hypotension? Is it B, hyperoxemia? Is it C, hypoxia? Or is it D, hypothermia? Because my babies, okay, I'm not supposed to call y'all my babies, but my babies know their prefixes, and they know that hypo means low, and they know that hyper means more than, and they know that oxia refers to oxygen. So if you chose C, hypoxia, you are right. So hypoxia refers to low oxygen in the tissues or blood, which can lead to confusion, shortness of breath, or even damage, organ damage, if left untreated. And so that's when you'll see us put the little pulse oximeters. That's how we monitor their oxygen saturation. So you'll see us put those on their fingers if we're concerned about them having low oxygen levels. So when are we concerned? If someone has a respiratory issue, if somebody is post-op, because remember they still have sedation, or maybe it's somebody who's receiving pain medication, because remember the pain medication, it can actually suppress their respiratory drive. And so when they go to sleep and they get really comfortable, aka their pain medicine has kicked in, their oxygen levels can be lower because they're not breathing effectively. 38, we're almost at 50. 38, the esophagus, excuse me, my chair is so squeaky. The esophagus connects is it A, nose to the lungs, B, mouth to the stomach, C, liver to the pancreas, or D, kidneys to the bladder? So we learned about the esophagus, we learned about the trachea earlier, and now we're talking about the esophagus. So the trachea was the windpipe. So by default, the esophagus, the other tube near the windpipe, must be what? Yes, that's right. It is B. The esophagus is the muscular tube that carries food from the mouth to the stomach. 39. Which body part is most at risk for pressure injuries when a patient sits in a wheelchair for long periods of time? Is it A, coccyx, B, scapula, C, patella, or D, sternum? And now look, I know you learned new terms today. So I know you know the answer to 39. And so I want you to drop an A in the chat. That is right. If you chose A, you understand that when someone sits on their tailbone all day, especially somebody who is chair bound or wheelchair bound, that is going to increase their risk of getting pressure sores. Sorry, it's so loud out there. So CNAs, sometimes your doctors will have, or your patients their family members may have just bought it, but they're going to have cushions and different things to put into a chair. Even with the cushions in the chair, they still need to get up out of that chair. They have to change their pressure source, because if they're 300 pounds and they've been sitting on that cushion, that donut for 3 hours, that donut's flat. That's still going to be an area for pressure. So even if they're in their chair, keep in mind they have to reposition every 2 hours. All right. Our next question is question 40. Which diet is most appropriate for a patient with gastroesophageal reflux disease, aka GERD? Would it be A, a high-fat, spicy foods? Would it be B, regular diet with extra fluids? Or C, bland, pureed diet? Or what about D, a low-acid, bland foods with small, frequent meals? I almost chose the wrong answer with that one. And I wrote the test. So just because someone has GERD does not mean that you have to puree their food. So the answer is not C. If it just would have said bland diet, yes, but not bland and pureed. So the answer is going to be D. Low acid, bland foods, small but frequent meals. So your patients who have GERD or acid reflux should avoid acidic, spicy, and fatty foods. Small meals help to reduce the pressure on the stomach. And again, a pureed diet would not be needed if the person only had GERD. In order for them to need a pureed diet, they must be at risk of aspiration. 41. When a patient has difficulty swallowing due to a stroke, food may enter the trachea instead of the windpipe. What is the main risk? Is it A, dehydration, B, constipation, C, aspiration, or D, hemiparesis? And those were some big terms, so I want you to practice them with me after the video. Go back and rewatch it, because I need you to speak in these medical terms so you sound knowledgeable when you enter the workforce. And so question 41, yes, the answer is C. If food or liquid enters the trachea, aka the windpipe, it can cause aspiration leading to choking or pneumonia, because if they're not able to cough it up, they're just going to sit in their lungs And then, of course, it's going to be a breeding ground for bacteria. And so repositioning your patient or positioning them, remember in that high phallus position during meals can help prevent this. And then also after their meal, you don't immediately lay them back. After their meal, you can recline them some, maybe about to 60 degrees, but you need to give their food time to digest before you lay them flat. Fortunately, most of your elder patients don't like to be laid flat because it's uncomfortable on their back. And so just sit them up during the meal. Make sure you explain it to them. Miss Gertrude, I can lay you back in about 20 minutes. I just want to make sure your food goes down to decrease your chances of having reflux. And most of them will understand. 42, a resident complains of lower back pain near the kidneys. Which CNA observation would be most important to document? A, patient's favorite sleeping position. B, color and amount of urine output. C, appetite before breakfast. Or D, whether they like cranberry juice. Your patient is complaining of back pain near the kidneys. What might that suggest? And what would it be important for you to document? Yes, because yes, the answer is B. And it's B because that can be a sign of a urinary tract infection. So since the kidneys filter waste and produce urine, changes in urine such as blood, cloudiness, or decreased output, also pain, dysuria, are important signs to report for possible infection or stones. So anytime someone's having that lower back pain near their kidney area, yes, you're going to document it, but something that this question did not, or this answer did not state, is that you notify your nurse also. And so I would like in your documentation that you put down that the nurse was notified. So patient, whatever the patient's name is, complained of pain to the lower back kidney area, pain 7 out of 10. Because remember, if you're talking about the pain, you also would have to do a pain assessment. Gave patient water and reported the findings to the nurse. And then in your documentation for your urine output, that's when you can document the color, the smell, and also the quantity of urine that patient produced. So you'd be documenting in two places. One would be your regular report, your nurse's note, your CNAs, you all have notes that you put in also, but then the other would be on your flow chart, your output documentation sheet. 43, a patient reports tenderness in the lumbar region. Which part of the body is being described? Is it A, lower back, B, upper abdomen, C, neck, or D, wrist? Tenderness in the lumbar region. That's right. Anytime you think of lumbar, think of the spine. So it is A. The lumbar region refers to the lower back. And so this is separate than lower back over the kidneys. This is kind of centralized. So the lumbar region refers to a lower back. CNA should be alert for back strain or kidney issues when patients complain here. 44. What does the term osteoporosis refer to? Is it A, a muscular disease causing weakness, B, a curvature of the spine, C, inflammation of the joints, or D, a loss of bone density? Break those terms down. Osteoporosis. So osteo means one thing, porosis means something else. And so together, that means not muscle weakness, so it wouldn't be A. Together, that means bone weakness, or the bones become porous like a sponge. So the answer is D. This condition makes bones weak and more likely to fracture. So osteoporosis, you'll see that commonly with women, especially as they age. And you'll also see that commonly if you work on an orthopedic floor. 45, a patient is described as a paraplegic. What does this mean? A, paralysis of one arm and one leg. B, paralysis of all four limbs. C, paralysis of both legs. D, partial weakness on one side. That's right. We're learning these terms. We're learning them together. We have to learn these terms. You just got a new admission. And when you look at the history, it says that the patient has paralysis. They're a paraplegic. You need to know what that means because you need to know what items to bring into the room. You need to be thinking about what type of care you're going to be providing. And so if someone is a paraplegic, that means that their legs are weak. So paraplegia refers to loss of movement and sensation in both legs and lower body, often due to a spinal cord injury. So this may be someone who's going to be wheelchair bound. It doesn't mean that they, are bed bound, because oftentimes when someone sustains a spinal injury, they go to locally, we have Brooks Rehab. And so at that hospital, they rehab them, they teach them how to use the wheelchair, they teach them how to do their own transfers. So you don't want to assume that because they're paralyzed that they're just bedridden. That's not the case. Some of them can still drive. Some of them still, do things that you would do. They still have a good quality of life, but you still need to be made aware that their legs are weak. And so if you have to transfer them, you're never going to be doing a one-person transfer. You're going to have help in that room. So CNAs, you're going to be assisting with mobility, positioning, and often skin care. Because if they get hurt or something, if you drag their feet, remember they're paralyzed. They can't feel it. And so be very careful when you're moving them. Question 46. A patient with quadriplegia will most likely need assistance with A, only walking, B, only bathing, C, all activities of daily living, or D, feeding themselves without help. So we talked about paraplegics, and now we're talking about quadriplegics or quadriplegia. It's the actual condition. And yes, you all four of their limbs are weak, and even their trunk too, their core body. And so quadriplegia is paralysis of all four limbs and their trunk. Sometimes they can turn their head, and so they may have a special type of call light. It's actually more like a straw device that has like this retractable crane. So you would put that retractable crane within reach with their device, and they can turn their head and they can blow. And so I've seen that before. That's how, since they can't move their arms and their legs, that would be one way they can call for help if they need it. So you make sure, regardless of your patient's condition, that if they are able to move anything, there's a way for them to get help if they need it. And so your quadriplegics usually require total assistance with ADLs. And so your ADLs, remember, your activities of daily living, that means they're going to need help with you. You're going to feed them, you're going to dress them, you're going to bathe them, you're going to take them to the bathroom, give them the bedpan, empty the catheter, and you're going to have to reposition them. You're going to have to transfer them. And so when we put them into the chair, we put them into their specialized wheelchair, and also those geriatric chairs, the ones that recline back. You may need a Hoyer lift. A Hoyer lift requires 2 people. I don't care what your facility says. If you don't have 2 people, don't utilize the Hoyer lift. 47. A patient with a weak immune system is placed on neutropenic precautions. What should the CNA do? A, put on full PPE. B, avoid bringing in fresh flowers or unwashed fruits. C, provide a high-fat diet. Or D, use airborne precautions. Weak immune system, neutropenic precautions. You all, they're on reverse isolation. We put them on isolation not because they can get us sick, but because we can get them sick. And so we're not bringing in fresh flowers, things from the garden that are unwashed, because we have to keep their room and their environment as clean as possible. So the answer is B. Neutropenic patients are at high risk of infection. Therefore, the bacteria on plants or raw food could be harmful to them. And yes, we're going to gown and glove up. We're going to have on PPE and the family members. And of course, great hand washing. So we have to do everything in our power not to bring anything into their room, because again, their immune system is weak and they could have an untoward effect, a lengthier hospital stay, end up on more antibiotics because of what we brought into them. Question 48. A patient with neuropathy in their feet is most at risk for which complication? Is it A, pressure injuries, B, dehydration, C, vision problems, or D, difficulty swallowing difficulties? Neuropathy. When you think of neuropathy, what are you thinking of? The fact that it says neuro means that it has to be a neurological condition, but a neurological condition affecting what? If you know nerves, you're absolutely correct. So whenever someone has neuropathy, that is like nerve pain. It's going to cause a decrease in sensation. And so especially like if you're giving them foot care or whatever, you want to make sure that you have them check the water temperature with their hand and then their feet. Diabetics or people whose legs swell because they have congestive heart failure, they can sometimes start having circulation issues, and they can also have neuropathy. They can have that neural type pain. And so again, they really can't feel as well. And because they can't feel as well, that's going to increase their chance of injury. So make sure they have on proper shoes. Something we can't be letting them have on flip-flops if they're diabetic with neuropathies, because if they have those flip-flops on, that means that their feet are at risk of injury. We're almost done, team. I'm so proud of you. Question 49. If a patient has aphasia, which ability is affected? Is it A, walking, B, urination, C, speaking, or D, breathing? And if you watch any of our other medical terminology videos, then of course you know that aphasia means the difficulty or the absence of speech. So someone who has had a stroke, maybe they could have aphasia. So aphasia is difficulty with speech, or if they, because of their stroke, they cannot speak any longer, that would also be aphasia too. So they can sometimes have problems with speech or comprehending what you're saying. And again, that's usually caused after a stroke. So CNA should use simple words. You're not going to ask multiple sentences or questions back to back. You're going to ask simple questions that can be answered yes or no. Give them an opportunity to answer that question before you ask the additional questions. And so you can use simple words, gestures, and patience when you're communicating with somebody who has aphasia. Our last question, team, we did it. I'm so proud of you. Ataxia is most often seen in patients with neurological damage. What does it mean? What is ataxia? Is it A, difficulty breathing, B, weakness in the legs only, C, complete paralysis, or D, lack of muscle coordination? Remember, when that A, that prefix A is in front of something, that means the lack of. So what do you think? That is right, because you understand your prefixes. You know that 50 is D. Great job. Ataxia is the lack of movement. So it's unsteady movement and poor coordination. When would you see this? When a patient has Parkinson's. All right. So, or maybe they have a neurological disease like Lyme disease. So ataxia is that unsteady movement, poor muscle coordination. And so you're going to prevent those falls by making sure they have their shoes on their feet. And you're also going to use that gait belt, because if they have unsteady movements, you already know they're a high risk for falls. And guess what, team? We did it. So not only did we have our 2 YouTube channels, one is youtube.com/my name, Eunice Mathis. That, if you want to see some personal behind the scene highlights, that is what that one's for. And then we also have the Florida Training Academy, the one that's on the screen. If you want to register for one of our CNA courses, if you want to take our NCLEX course or IV therapy course, our phlebotomy course, they're in person, you all. You can go to fltraining.com. You can register. You can see our course calendar. If you're interested in taking our online CNA course or our PCT courses, which are also online, go to fltraining.com, click on the menu, the 3 lines, and then you'll see our online courses. And don't forget that you can also download our freebies and also our $7 vital sign bundle and our other CNA bundles on nurseeunice.com. Look, we appreciate you all for supporting us. And don't forget, that is right, that caring CNAs become caring nurses. If you've ever worked with someone who was uncaring as a nurse, you're going to understand how important it is to actually follow the route, the trajectory that you're doing right now, because you're learning how to communicate. You're learning how to do those hands-on skills. You're actually making your nursing school, your career easier because you're learning it from the bottom, okay? And caring is so important. A person doesn't care about a lot of the things that we do as nurses. What do they care about? The fact that you as a CNA, you brought their food in with a smile, you refilled their water pitcher, you gave them a warm bath, you put lotion on them. They can care less about a lot of things that I do. So you are that shining star. You are the backbone of healthcare. And I want to let you know that me and a lot of nurses and doctors and patients appreciate you. So great job, team. If you haven't done so, don't forget to like, share, and subscribe. And you can pass your CNA exam with Nurse Eunice at nurseeunice.com. Thanks for watching, everybody. I'm going to try to be back on here tomorrow. Tomorrow I have one of my in-class courses. And so we have either they are nurses who maybe have been out or away from the bedside for a while, or they are nursing students who were unable to pass the NCLEX, or nursing students who just passed the NCLEX after leaving school years ago. And so tomorrow is my NCLEX course. So I'll try to get another video out tomorrow, but it may be something that's more geared toward nurses. But I hope you love me regardless. All right, everybody, I love you. Don't forget to like, share, and subscribe, and I'll see you in the next video. Bye.